Good morning, and welcome to day 2 of the National Minority Equality Forum Leadership Summit. Yesterday, we heard more about health disparities, the devastating effects of the social determinants of health, and how these disparities impact various communities throughout the COVID-19 pandemic. Additionally, we heard about how we can advance health equity, eliminate systemic racism in healthcare research, and how we can support the clinicians and practitioners. Each of these topics have been so important to my work since coming to Congress. I am Robin Kelly, the Congresswoman from the 2nd Congressional District of Illinois. As Vice Chair of the Energy and Commerce Committee and as Chair of the Congressional Black Caucus Health Braintrust, I've had even more opportunity to focus on healthcare disparities at the congressional level. In 2015, I released the Health Disparities in America report, and out of that report came several key recommendations: improving access to healthcare, increasing diversity in the healthcare workforce, prioritizing innovation and research, focusing on community engagement, and taking federal action to fund resources and initiatives to help tackle health disparities. Since the release of this report, I have been working to ensure the recommendations made become policy. Thankfully, we have been able to make progress on these priorities. Last year, I introduced and supported several measures to tackle the disparities we have seen within the COVID-19 pandemic. Following a spike in COVID-19 cases in correctional facilities, I joined several of my colleagues in introducing the COVID-19 and Corrections Data Transparency Act to require the Bureau of Prisons, U.S. Marshal Service, and state and local correctional facilities to publish COVID-19 case and outcome data on their websites, as well as to report that information to the Centers for Disease Control and Prevention. I also led the Congressional Caucus in introducing the Ending Health Disparities During COVID-19 Act. This bill focuses on data collection, COVID-19 testing, contact tracing, public awareness, community grants, health IT, insurance access, safety programs, and increased federal oversight, a mouthful. The COVID-19 pandemic has also renewed our focus on providing increased access to telehealth. Telehealth has the potential to be the great equalizer in healthcare if done correctly. Many practitioners I've spoken with have said their patients have been more likely to keep appointments and schedule checkups when they are able to use telehealth. Telehealth eliminates the need for childcare, transportation concerns, and allows for more flexibility in scheduling and choice in providers. I've spoken to young folks who said they didn't have to miss school, or working parents who said they did not have to miss work. Even as we begin to move past the pandemic, I want to ensure that we keep our focus on expanding the use of telehealth. To do this, we need to work on broadband expansion, ensuring that everyone has access to a smart device, and computer literacy. I've also made programs in the maternal health space. Last year, we passed my Helping Moms Act to extend access to postpartum care for new mothers who qualify for Medicaid. I successfully fought to include this provision in the American Rescue Plan. So now all states have the option of extending postpartum care beyond 60 days and up to 1 year. Just a couple of weeks ago, HHS Secretary Becerra approved Illinois' waiver to extend this coverage, so we know that women in Illinois will have access to life-saving postpartum care for up to 1 year after delivery. I am hopeful that other states will see how beneficial this is and follow suit. So proud of Illinois. Earlier this year, I reintroduced my Supporting Best Practices for Healthy Moms Act, which directs CMS to publish guidance for hospitals and other maternal care providers on ways to reduce maternal mortality and morbidity under Medicaid and the Children's Health Insurance Program, or CHIP. I am currently working to introduce my bill, the Mamas Act, which will require the CDC to provide technical assistance and best practices for preventing maternal mortality and morbidity. We have so much work to do to address maternal health disparities and maternal mortality, which is on the rise. This is an issue I look forward and feel committed to continuing to address in Congress. We also need to continue protecting and improving the ACA, expanding Medicaid and Medicare, lowering drug costs, and increasing diversity in the healthcare workforce. President Biden, Vice President Harris, and their administration has already indicated that they want to focus on expanding healthcare access, improving quality of care, and working to end health disparities. I am confident that the Biden-Harris administration is going to be an excellent partner in tackling some of these issues over the next several years. I know these issues are at the forefront of the work of the National Minority Quality Health Forum and are priorities for those of you joining us for this leadership summit this week. Thank you for your focus on this important work and your dedication to providing access to top-level healthcare for every person in this nation. With that, I'm going to turn things back over to our host to kick off day 2. Have a wonderful day.